Thank you for joining me for this update on Health Education England's Advancing Dental Care Review. As you may recall, this review was set up 3 years ago to look at the continuum of education and training that is delivered in the health service and to make suggestions for improvements where necessary. I'm delighted to say that the final report has now been published on Health Education England's website on the 21st of September and is available through a link on that site. I'd like to thank all those who have been involved in the work over the last 3 years, not only those who have been involved in the project itself, but also those who have contributed, trainees, dentists, colleagues, other organisations who have commented and helped us to come to the conclusions that we have been able to reach. There are over 20 recommendations and actions within the report, and I'll take you through a few of those headlines of those just to give you a flavour of the direction of travel. We want to particularly look at the first 2 years post-graduation, which is currently, of course, dental foundation training and dental core training. And while there are some 2-year models, we think there should be more of those. So whilst we wouldn't want to convert all foundation training posts into a 2-year model, we think there is definitely scope and a need to deliver a greater range and a greater number of posts of that type. We also want to look very closely at the following years, the years of currently dental core training 2 and 3, to see how that can be made much more broad-based and relevant as part of the development of the career pathway. So we're going to have a close look at how we can use other dental areas which might currently be used for that sort of training to deliver a more broad-based approach. Throughout the programme, we're also including in specialty a need for flexibility. What we're hearing very much from trainees is the need these days for probably a much more flexible approach to their education and training than perhaps we've delivered in the past. So we need to think about how we can develop the programmes, the existing programmes as well, to develop a more flexible opportunities, step on, step off, that sort of approach, part-time, than we currently have available. We're also conscious that training is probably not well distributed around the country, and there are quite a lot of areas in the country where training currently either doesn't exist or it's in a very patchy state. So we're going to look at our existing training posts to see how that might be changed so that we make a more equitable approach. That will take some time. It won't be something we can do overnight. We can't destabilise existing systems, but we need to start those conversations to get to that point. We also need to think about how we can recognise other training pathways with regard to accreditation of experience or learning and how that might fit together. That's not entirely in Health Education England's gift, and we will need to work with our friends and colleagues at the General Dental Council on some of those areas to see how we can progress. We also need to be aware, of course, that this report is for England only, and therefore there are other mechanisms which take place in the other administrations in the UK. And it's really, really important that we start to work with them as well to see how we can develop systems which work for Health Education England but don't disadvantage the other nations. We think in the report that that hasn't happened, but we do think there is room for conversation to see how we might develop things even further. We also are aware of the need for more impetus in digital learning. We've done quite a lot in the light of COVID, but that's probably mainly been around delivering lectures and that sort of learning. We now need to think how we can make use of modern technology and digital technology to deliver some of our hands-on training, to make the training experience even better, and also to improve the skills of our colleagues to the benefit of patients. On a more niche area, we are going to look at performers list validation by experience, or PLVE, which is the way that overseas dentists enter the performers list in England. And we're looking to see how we can streamline that approach to make certain that we are actually maximising the use of the workforce that might be available to us. We're also looking at the pre-registration training and education at undergraduate level and entry into undergraduate level, so that we can actually widen access and participation to get the best skills from those areas for people who might not at the present time consider dentistry as a career. As part of our approach also, we are going to look closely at the interface between that postgraduate and undergraduate change, or undergraduate to postgraduate change, so that we can make that more as a seamless approach for the benefit of the trainees who are taking part in that change, and also for the benefit of patients and the service. Another innovative thought we have in mind is the development of centres for dental development. And this concept is to look at the bringing together education and training and service in those areas where there is currently a paucity of both. We would need to work very closely with our colleagues in NHS England to achieve that effect, but there are areas where that sort of approach could benefit all elements, both the service, the patients, and education and training. We haven't forgotten dental care professionals. Although we don't directly commission apprenticeships, we can influence the direction of travel, and we propose to work with colleagues again to try and create more opportunities. We're particularly keen that a dental hygienist apprenticeship should be introduced, and we will be looking to move that forward as well as the other apprenticeship areas. We are particularly looking at developing opportunities for dentists and dental care professionals in primary care, particularly with regard to the level 2 commissioning that NHS England undertakes and the possibilities of a greater use of skill mix across the board in the NHS to produce a career progression which perhaps doesn't exist at the present time. How are we going to do this, you might ask? Well, we have now commissioning a dental education reform programme, a 4-year programme funded by Health Education England to take this work forward. The team is already in place and the work has already started. But we were looking to work again once more with partners to start to move over the next 4 years these elements forward. Some we can deliver relatively quickly, some will take quite a lot of time. What we are determined to do is that the direction of travel is established and cannot be turned around, although we may of course need to adapt as circumstances change. My colleagues and I are part of the programme, and I'm looking forward to being involved in this programme. But also we need involvement, of course, of all of you. So we will be looking to work together, develop a national framework, but within that, a local delivery pattern, because not all areas are the same and we need to adapt to make certain that's the case. So I hope you will join us on this journey, and I look forward to working with you.